Welcome to Akin Community Health TV. Our topic today is on secondary hypertension, pathophysiology of hypertension, diagnosis. Kindly support me in Jesus' name by subscribing, liking, and sharing. Secondary hypertension. Secondary hypertension results from an identifiable cause. Kidney disease is the most common secondary cause of hypertension. Hypertension can also be caused by endocrine conditions, such as Cushing's syndrome, hyperthyroidism, hypothyroidism, acromegaly, Conn's syndrome or hyperaldosteronism, renal artery stenosis, atherosclerosis or fibromuscular dysplasia, hyperparathyroidism, and pheochromocytoma. Other causes of secondary hypertension include obesity, sleep apnea, pregnancy, coarctation of the aorta, excessive eating of licorice, excessive drinking of alcohol, certain prescription medicines, herbal remedies, and stimulants such as cocaine and methamphetamine. Arsenic exposure through drinking water has been shown to correlate with elevated blood pressure. Depression was also linked to hypertension. Loneliness is also a risk factor. A 2018 review found that any alcohol increased blood pressure in males while over 1 or 2 drinks increased the risk in females. Pathophysiology. In most people with established essential hypertension, increased resistance to blood flow, total peripheral resistance accounts for the high pressure while cardiac output remains normal. There is evidence that some younger people with prehypertension or borderline hypertension have high cardiac output, an elevated heart rate and normal peripheral resistance, termed hyperkinetic borderline hypertension. These individuals develop the typical features of established essential hypertension in later life as the cardiac output falls and peripheral resistance rises with age. Whether this pattern is typical of all people who ultimately develop hypertension is disputed. The increased peripheral resistance in established hypertension is mainly attributable to structural narrowing of small arteries and arterioles, although a reduction in the number or density of capillaries may also contribute. It is not clear whether or not vasoconstriction of arteriolar blood vessels plays a role in hypertension. Hypertension is also associated with decreased peripheral venous compliance, which may increase venous return, increase cardiac preload and, ultimately, cause diastolic dysfunction. Pulse pressure, which is the difference between systolic and diastolic blood pressure, is frequently increased in older people with hypertension. This can mean that systolic pressure is abnormally high, but diastolic pressure may be normal or low, a condition termed isolated systolic hypertension. The high pulse pressure in elderly people with hypertension or isolated systolic hypertension is explained by increased arterial stiffness, which typically accompanies aging and may be exacerbated by high blood pressure. Many mechanisms have been proposed to account for the rise in peripheral resistance in hypertension. Most evidence implicates either